I haven't received this before. What is this? Riverside?
Riverside, yeah.
Oh, damn, it's really cool.
I love it, man. Have you done a lot of podcasting in the past?
Mostly on like Zoom and stuff, but not really like a full length podcast.
Yeah, I mean, I just chat, right? Like I already hit start.
Yeah.
Like we'll get into it, chop it up a little bit. But I like this Riverside one. It gets a good recording, both audio and video, and then it helps you. It's got a lot of tools in the if you're ever considering doing it. It's got a lot of tools in the back end to kind of help you format it the way you want, cut out all the
Yeah.
ums, the ahs. Yeah, yeah.
Nice.
How was your day? What's going on?
It's pretty uneventful. I mean, I'm just starting, literally just started working like 2 months ago now. So I'm still slowly kind of getting used to that. Every day is kind of different, but for the most part, pretty chill. Just worked out
Where
and had dinner, and yeah.
where are you located?
I'm in Tennessee right now.
You're in Tennessee? Wait, where was because you did GPR residency? I thought that was in California.
I was out in California my whole life, yeah. And as of 2 months ago now, I just moved out here, and it's been a change for sure. But yeah, I'm down in Chattanooga, which is like the border Georgia Tennessee line,
Yeah,
but it's
yeah.
like 2 hours from everything. So yeah.
Chattanooga. I was just in North Carolina
Uh huh.
last weekend, and there were a couple guys and girls there from Knoxville. That Knoxville.
Yeah,
I mean, I have no idea where is respect to you down there, but just throwing it out there.
that's like I think I drove. That's where like UT is, like the main Tennessee you think of for like football and all that. But it's like an
Hmm.
hour and a half away, so it's not too bad. But yeah, sick.
Wait, I
Are
gotta
you?
switch in the
Yeah,
view one more time. There we go. There we go. I got it. I learned a while back. I don't know. I
yeah,
got to make sure that we're both facing the same way because
got it.
mine's actually a mirror and then a flip. Anyway,
I
it makes
see.
like the thumbnail look better. Why Tennessee? Why'd you switch it over there?
Dude, so okay. I've been in California kind of my whole life, like I was saying. So I don't know. I'm sure you're in New York right now.
Yeah.
Yeah, I feel like pretty similar to New York a little bit, but California is super saturated with dentists coming out of school and stuff. They want to pay you just like what they can pay you and kind of overwork you because they know that hey, you need a job right out of school or out of work. But then I found a practice out here through family friends that was actually like paying pretty well, offering like mentorship and all that. So I made a switch. Thought it'd be kind of cool to get out of that little bubble because I've literally been kind of in this hour vicinity of everything from
Hmm.
undergrad to dental school and GPR and all that. So it was nice to kind of get out of there. I think eventually I'm going to go back. I don't know where yet, but I don't think this is my final stop. That's for sure.
Okay, and that's fair. That's fair. So you were all within about like an hour to 2 hours in California. Where'd you go to undergrad, then dental school?
Yeah,
Just so listeners, I want to let's set the
yeah,
scene,
for sure. So have you ever been out there before or not
dude.
yet?
I've never been to California. I'm a big wine
Really
fan. I love red wine. I've never been to Cali.
interesting. Okay, so there's like a little part of Northern California called Bay Area, and that's kind of where like all the tech stuff is and stuff.
Hmm.
So I went to undergrad in it's called University of the Pacific. So they have like a feeder program, lots of like those BS, GDS things. Theirs was more inland. So you're mentioning wine, kind of like an hour and a half east of Napa and so. And then I went to dental school out in San Francisco, which is pretty close to Napa, like an hour or so away. And then afterwards, I went down to the VA in Palo Alto, which is like 40 minutes down south of SF. So within this whole Bay Area is literally like a triangle. And now I'm all the way out here in Tennessee. And yeah, it's been a good adjustment. Surprisingly, it's been a lot more different than I thought in good ways and in bad ways. But yeah.
Wait. Let me hear a good way. Let me hear one bad way. I'm curious. Let's get into it.
Okay, I don't know if it's the same out there, but I'll say that in California, people are a lot more. I feel like it's very go 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 out there,
Hmm.
and like tech startup, all that. So people are kind of head down, focused on their own thing. But I feel like it might be like the Southern hospitality and all that. Everyone's super kind out here. Like, will genuinely take time of their day to help you. Like, not like a surface level type of thing. And it's something I've had to get kind of used to. But I think it's been a positive change in that way. Like, getting to talk to just people and just like getting to hear about people's days. It's been a really nice change.
How's the accents?
Okay, so that's the thing with the younger generation. There's not really an accent. I can't really
Yeah,
tell.
right.
Yeah, with the older ones, oh, you hear it. You hear it pretty bad, and they bring up a lot of stuff when I mention I'm from California. Yeah,
I can't imagine what they're bringing up.
yeah,
Yeah, sometimes it's like, can you repeat that one more time a little bit slower?
yeah. I mean, New York accent is a little thick too, but I feel like Southern might have it beat out a little bit.
Yeah, yeah. The New York accent. I don't know. I feel like the New York accent's just like unnecessarily vulgar. It's just vulgar. It's vulgar for no reason. Like the Brooklyn, Long Island, like the
Yeah.
Queens accents, the Bronx, but that like Jersey Shore. Anyway, yeah. Here's another comparison that I've heard a couple times now. Have you
Let's
ever
hear
heard
it.
of like the changing tire analogy between New Yorkers and Californians,
No.
where there's like you like break down your car on the side of the road, and if you're in
Mhm.
California, people will go by like, oh my god, I feel so bad, I'm so sorry,
Yeah.
and you're like, can you help me fix this tire? Like, I don't even know what to do. And they're like, no, I have no idea how to do it either. But dude, I'm so sorry, And
Yeah.
then
Yeah.
and
That's pretty
then
spot on.
if you break down in New York, they're like, what the hell? You don't know how to fix a tire? What's your problem? Like, what's wrong with you? And they'll fix it for you, and then just keep going. So it's like, I don't know. I heard that analogy, and I'm like, that is a totally a New Yorker, where they'll just curse you out, but fix it for you, and then leave.
It's pretty accurate. It's pretty accurate, so even for California. Were you out in New York your whole time, or?
Yeah, New York, New Jersey, a little bit for just, I mean,
Mhm.
just over the Hudson River for
Yeah.
2 years in college, and then Long Island. Yeah, so Long Island and New York, Manhattan area,
Mhm.
pretty much the whole time. I have family in Florida. You said you have family in Tennessee, huh? Did you? You
One.
have family
So
friends?
the
Yeah.
practice I'm at is actually my uncle's practice. I use uncle loosely, relative of a
Mm,
relative type of thing.
yeah.
But that's pretty much it. So it's been a big change just getting to, I don't know. I think one, it's like when people say, oh, I'm moving to a new city, obviously there's getting used to that. But I think moving to a new city where coming from San Francisco, it's a huge, from a bigger city down to like a smaller kind of town almost. It's a big, big change, let alone not knowing anybody. Was something I was really worried about. But the office is really tight knit. A lot of the employees there are pretty similar age to me as well, so it's pretty nice. They've been able to show me around and stuff. Surprisingly, I've done a lot of stuff that they haven't done yet. But yeah, it's just a family practice so far, and it's getting a lot busier. He's only been here for about a year or so.
Oh, so it's very very early on. Yeah. And so your quote unquote uncle, young dentist, older dentist.
He's like 50s, I want to say. Yeah,
Okay, so young, but he's been in it
yeah,
for 20 years. Yeah, yeah.
exactly. Yeah.
And what are some of these procedures that you're doing that he or other people haven't done yet? I'm curious. Yeah.
Well, not procedures in dentistry. I mean, just like things I'm doing in Tennessee. But do you mean like dental procedures and stuff? Because right now it's
Oh,
pretty much bread and butter for me and stuff. But
I thought you were saying dental procedures. Okay,
no,
okay.
no, no.
No, that's
But
awesome though. Yeah.
I will say it's been nice to have a GPR kind of under my belt, or just working in a hospital setting. Like I'm sure you know. I've seen stuff that it's me and two other associates or two other
Mm.
dentists there that they haven't really seen either, or they just, kind of learned about, but never really experienced. So it's kind of nice that even though I am a new grad, even though I am on the younger side for the practice, I am kind of able to kind of bring in a new perspective that they wouldn't have considered per se.
They didn't do
Mhm.
GPRs?
Not that I believe, no.
And then so then your uncle owns it. So it's four dentists total?
Three dentists total, my bad. So him and two of us.
Oh, sweet. That's a pretty good. So it's got to be a pretty sizable a lot of chairs in order to fit.
Yeah. I think we're at 7 chairs now. So it's definitely getting busier for sure. But yeah, I think the population out here too, and just what I'm seeing every day, obviously compared to the VA, it's a lot more tame than that. But
Mm.
um, yeah, it's just a lot of lots of extractions, routine, just like bread and butter type of stuff as well.
Yeah, yeah, yeah. No, that's excellent. I really like the VA portion. I just graduated in June as well, so
Yeah,
I'm
yeah,
only 2 months in also. So we're pretty much on a similar trajectory as far as like career timeline. But I really like the VA. I think the VA might have been my favorite
yeah.
rotation. We were at like the public hospital, we had the private hospital, we had the dental school, and then we had the
Mhm.
VA. I love the VA because the full service connected
Yeah,
veterans, right? Right?
yeah, yeah. It's like
Is it covered? It is.
they
All
don't.
right, I'll take it.
They're like, I'll do it.
That was always pretty awesome. But then, how is that in Tennessee? Right? Is it really coverage driven? Are you in an area where it's like it's fee for service? Are you taking a lot of insurances?
My area right now is fee for service. There's also a VA that's actually pretty close to us as well.
Hmm.
But it definitely is in Tennessee. There's I don't know the state, because we don't work with the state insurance here,
Hmm.
but we still are a pretty kind of busy practice, I'd say. But we are fee.
Yeah, yeah, yeah. Oh, that's great. Fee for service. That's the name of the game, right?
I'm good, yeah. I saw you were mentioning something about insurance, right? Like I do agree, like nowadays, like it's really frustrating. Even though I just started, like hearing about it and kind of just seeing what we can and can't do and kind of how they're dictating treatment stuff, it's
Everything,
getting
right?
really kind of frustrating, you know? And then obviously patients don't understand that side of that either. And they're just assuming, hey, why is my dentist scamming me? That's a trigger word I feel
We're
like
always the problem. We're always, yeah, we always get the blame. That's yeah. I'm gonna stop talking about like actual the numbers of what get reimbursed and everything. I think it's really important for especially dental students, younger people, and even patients to understand that when an insurance company tells you that, yeah, you're 100% covered, that 100% is often 10 to 20% of what the practice, it costs the practice like take a tooth out or to put the implant in. And
Mhm.
that's very misunderstood because they'll call up the insurance company and they'll say, oh, yeah, you could go to these offices, you're 100% covered there.
Yeah.
And that doesn't actually mean you're 100% covered. It's what do they say? Who is it? Dental Nacho said it's a coupon from the 1970s, and it is. It's so true.
Yeah.
But yeah, there's such a mismatch in education to patients, and
Yeah.
then I feel like that's getting transmitted to dental students and
Exactly.
younger. You know what I mean? What are your thoughts on that?
In terms of just like the what dental students are hearing versus like what they're learning in school versus like the real
Just
world.
everything you just said too, because like the insurance reimbursement for treatment we do is 100% covered. It's not right. It's percentage, but then that we get the blame for that. Like, well, why is it so much more? Or like, why does it cost so much more? And I don't know. What are your thoughts on that? If you,
It's
you know,
honestly it's kind of frustrating too because I don't know. Like I was talking about the whole scamming thing and everything like that. I feel like I'm in a position where I have to try to convince the patient that I don't mean like I'm not scamming them. It's insurance that kind of is, you know. And it's interesting too because especially at the end of the day, the reality is it does kind of come down to insurance when they're saying things like, you know, like I only want what insurance will cover, for example. And it's like, hey, like yeah, insurance will cover things, but they're not the ones that are kind of looking out for your health here, you know? Like it's us that is. But kind of building off that, I want to know what you think about this as well. So I feel like within dentistry, it's the one sector of healthcare that's very, I guess, considered optional almost. Like a sense like you go into a dental office, they say you need like a root canal or something. They'll usually question it. They'll be like, "Do I really need that?" Or I don't want it. I'm gonna go to see get a second opinion somewhere else. Whereas you're in the hospital, you know, you need heart surgery or something. No questions asked, you're going to get it. So I don't know. What do you think about that too? Just kind of
oh yeah, all the time.
optional or
All the time. Is should it be optional? I mean, sure, you can wait for this to become a problem, but then like I've literally seen these people when it becomes a problem and they
Mhm.
can't breathe or they can't swallow and the swelling is out to here and they're in the hospital for a
Mhm.
week and we got to do surgery on them and they have
Mhm.
scars in their neck now. Yeah, like yeah, I've seen it, I've done it,
Mhm.
and it's like I've done it on patients that we warned. Like I see them first year in residency and they're back with that third year residency. And it's like, dude, what we
So,
talked about this 2 years ago.
yeah.
And but yeah, so from what you're saying is like I totally agree. I'll have patients that come in right now. We take most insurances,
Uh-huh.
and they'll come in and it'll be like covered too, and they're like, no, 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 I know they referred me for 5 teeth, but I
Mhm.
only want these three out because these are the one bothering me. Right? That's you hear that all the time, right?
Yeah.
And it's a problem, and the problem just grows and grows, and then whether it becomes an infection, acute infection, we gotta go to the OR to drain it, or they lose so much bone around it to replace the tooth. They just lost a couple options, whether it be replaced with a single implant, a media implant, or for listeners, if you let a chronic infection linger too long, it could blow out the bone around the root. It could really degrade it and eat away at it. And what do you put an implant in? It needs to be integrated into the bone, right? So if you don't have any bone, you're just setting yourself back months to years waiting for that bone to get implanted, right? But yeah, dude, that's. I wanted to get into these topics with you. You've been doing a lot of good content, man.
Yeah, yeah, let's talk about this.
That's on that.
Yeah, thanks, man. I feel like yeah, even with like going off this implant thing, now I'm kind of, it's like when patients come in, I think one thing I've noticed is when they come in, it's like they already have a treatment plan, I guess, in mind of what they want to do or what they want to hear. And usually that turns into, I just want it out and I'm going to get an implant down the line. And then it comes become your responsibility to explain to them, hey, it's not that simple, you know, like it's kind of a domino effect. But yeah, I don't know. Really interesting stuff.
Oh, for sure, for sure. And to just round out that topic a little bit, like so many times all the patients come in, and most of the time it's like, okay, we're not saving that tooth. I mean, I don't
Yeah.
know why it's been there for so long, but there are a lot of times where it's like This is a wisdom tooth, and I know you referred to get all four out,
Hmm.
but I had this today. One side it's out of occlusion, but the other side it's like, you're cleaning these just fine. You're
Hmm.
using them, so they're in functional occlusion,
Hmm.
and there's no cavities or anything. I'm not
Yeah.
going to take this out. Like you're literally using these right now. You're not in pain. You're cleaning them fine, and yeah. So that's another thing where it. But yeah, unfortunately, it's like most teeth that come to me, they are non-restorable. They're
Hmm.
completely done. But for you, you with the task that you have to explain to these patients that we're not there yet. We could save this tooth.
Hmm.
And they've, like you said, they've either already made the conclusion that no, I don't want a root canal. I saw this Netflix documentary and I just want
Yeah.
an implant. Right? You've heard that one too, I'm
Yeah,
sure.
yeah. That's another topic. I'm curious what you think about this. The whole like biological dentist type of thing. The whole. I mean, I've open to learning more about it. I've been watching videos on social media about like I think I saw one this morning of like come tour my office with me and kind of what makes it different than a typical dental office.
Hmm.
And I just don't know if it's something I don't have enough research in or if there's just not enough research in it, period. But I'm actually curious what kind of, if you've had any patient encounters, I guess, asking for more like, I've seen online, you can blast this tube with ozone and save it type of thing, or something like that.
Yeah, the most recent one is that cavitation. I don't
Mm,
want any cavitations after this tooth comes out. Isn't it going to leave a cavity that I'm going to have to clean it for the rest of my life so that
mhm.
bacteria doesn't fester? And I'm like, no, dude, like this whole cavitation thing, and you're not going to bone graft a wisdom tooth site for the fear of a
Yeah.
cavitation. What is a cavitation? What It's like a little crater in your gums. That's fine. Just brush your teeth. Like you. It's no. I think there's like with the naturopathic doctors, there's a very good side of it because they consider a very much more holistic picture. I see that with, for example, like a close friend of mine is getting like had a lot of stomach allergens,
Mhm.
and then they did a whole bunch of blood tests, and found out that like they were literally allergic for several months to chicken, and that was their primary
Mm.
diet. And then their stomach issues went away. They slowly phased it back in through a bunch of like medications and stuff. So like it definitely works. But in dentistry, just from my experiences, I see a big spa movement. It's really just like they're just trying to get off the insurance plans. They're trying to consider therapies and treatments that aren't covered by insurance, so the patient has to pay out of pocket. There's a lot of marketing behind these things, like this whole cavitation trend on TikTok. Like, who started that? I'm not bone grafting your wisdom tooth site unless it's indicated, because sometimes it's indicated if you have bone loss on the distal molar. Okay, yeah, actually, it's bone grafting there to rebuild that bone is might be indicated, but I don't know. Is that what you're saying? Is that what you're
No.
seeing too? With
Yeah,
the
that's what I'm seeing as
biological.
well. I think the biggest thing that I've seen is probably just the root canal thing. Like, oh, I've seen this about root canal.
What do you
Fluoride.
tell your patients? Yeah, the fluoride. We could get into fluoride. Unfortunately, it's tough because the fluoride is very political
Yeah.
intertwined. I feel like so because you could make the argument for fluoride, you can make the argument against fluoride. Like I've seen both sides but with the root canal. What do you think about the root canal? How do you respond to a patient who's like, no, I don't want this root canal, like the plastics in my body and cancer?
I kind of just say so a big kind of philosophy I'm trying to go for it. I'm kind of contradicting myself a little bit here. But something that's helped me, and one of my attendings back in GPR told me this, and it's like, hey, we're more of a consulting service if you think about it than we are an actual, at least in the hospital, that's how it kind of felt. So nowadays I just tell patients, there is no kind of literature showing real harms for, root canals or anything like that. But I'm just saying what I know. If you'd like, I'm more than happy to pull it for you as well. But I just want you to know that this is a savable tooth, and these are the kind of what you can kind of look forward to down the line. Should we opt to kind of take this out if you don't want to go forward with the root canal and stuff? And I feel like most of the time, it all comes down to money again at the end of the day. I feel like most of the time that kind of scares them, or not scares them, but it kind of tilts them back into realizing, hey, maybe this 20-second video I saw on TikTok isn't all that anyway. And then, yeah, it comes to they come to their senses after. But yeah, I don't know. Root canal's a big one. And then what else have I heard too?
I think the root canal is such a great option. We're going to try and save the teeth. Now, if it's going to be your third root canal,
Yeah, yeah, that's different.
maybe not. Second ape to go, third root canal. All right, maybe it's time to go. But otherwise, yeah. There's been a lot. There's been a lot of different trends and stuff.
Hmm.
But what's your favorite part with intertwining? Because here, we both make social media content. We have our own niche. We really try and like make
Hmm.
stuff what we like to do, what we find exciting, but also to like teach and educate.
Hmm.
How do you kind of, I don't know, tell me What do you like about it? What's something recent you're on?
About social media or just like being on it and stuff, or
Yeah, content creation, social media, like whatever. We could talk about anything too.
yeah,
I wanted to get into some of these topics that we had. I
yeah.
was trying to pull up a video of yours.
It's pretty hard. I mean, I think I just like, I've realized that my personality is I try to take things kind of lightly. I think humor is a big thing for me, and I try to reflect that on my content as well. And I feel like it resonates with a lot of people. Like even myself, when I'm scrolling on these things and I see, hey, that's pretty relatable to what happened today. I'll send it to my assistants, be like, remember this patient, and it's like an
Yeah,
exact scenario of what happened. So I feel like that's something that I kind of like too. And just like, I think a big reason why I started my account in the first place is that I wanted to kind of showcase to students, pre-dental students, kind of what dental school is like. I think now it's kind of taking on a different form of what life after dental school is like. Because
yeah,
you see all the videos glamorizing the plastic teeth, like all that type of stuff, but like it's a big question mark when you don't kind of know what happens afterwards too. So
Hmm.
I don't know, just kind of shedding some light on that too, shedding some things I've learned from GPR year, which not too many people really know about that either. I think that's been kind of helpful for me, and just kind of being able to, there's been a lot of people that have kind of asked about, hey, what do you do what do you do in GPR? What do you do right now and stuff like that. So just kind of shed some light on that has been really nice. Yeah.
Is that one of the things, like the top things that people have reached out about? Because that is such an important distinction.
Yeah.
Do I go right into private practice right now, or do I take another year, maybe not
Yeah.
making as much money, but to get a little more experience in a GPR year,
Mhm.
or two GPR years, or a
Yeah.
residency? You
Yeah.
know,
People have asked about that. Like, hey, this is my situation. Do you personally think that doing a residency would be good for me? I should start working. Honestly, it's a very hard answer. It's a very hard question to answer because I
personal
don't know
too.
their circumstance or anything too. Like, so I don't know. I just tell them kind of about my experience, and I can only answer obviously what I know about my program, because the blanket term is GPR, but every single program is different. Even within the VA system, every single VA is different as well. So it's really hard to answer that. But I mean, yeah, I think that's just kind of how it is with dentistry. There's so many different paths you can take. I don't think there's
Hmm.
necessarily a right or a wrong one, but yeah,
The GPR at a VA is just such a desirable spot. I mean, any residency. If I was to go back, and I get to ask like what other specialty you would do, the fact of the matter is, regardless of the specialty, I would try and go to a VA. Just because the sky's the limit at that point, and then that gives patients greater access to care if there's full service connected, of course, right? They're
yeah, yeah.
veterans. But the fact of the matter is, like, there's so many different ways you could treat a tooth, or you could treat a condition, or for example, full mouth rehabilitation. Like,
Mhm.
there's so many different options, but the finances often restrict that option to maybe one or two things tops. But at the VA, now it's like everyone has a personal situation, kind of like mentoring. Do
Yeah.
you do a GPR? Do you start practice? Well, for a patient, we can have these five options that we can actually do now,
Mhm.
but these one or two fit you better
Yeah.
than just these one or two because they're finance driven. Yeah, I really think it's huge for the people, for the students thinking about that. They have to have the self awareness to recognize what's their situation now. Do they need to start practice? Maybe they need to support family members and whatnot. Like that's a different circumstance. But otherwise, getting a little bit more experience at a good program that they researched, they got an idea of what the faculty members are like there, the mentorship at the program, the procedures they're going to be doing. That's going to go a lot further in their career having that experience. And it's just one more year. You know what I mean? But yeah, so.
I've been to ask you, did you figure out about oral surgery during dental school, or is that something like at the very beginning going into it? Did you know, hey, I want to do this, or is it something you kind of figured out as you progress?
I was definitely interested in it going into dental school, but I knew it was one of the top of the list where I was like, I want to learn more about orthodontics, but I know I have an interest in oral surgery. I want to learn a little bit more pediatrics. That crossed off pretty quickly. But what about you? What about for you? What about for you? Did you look at any specialties at anywhere along the way?
It's funny you asked that. If you ask all my friends, I kind of went through a phase with every single one.
Yeah.
It was like, honestly, I think ortho is the one I through the least. But I haven't mentioned this to other people, but during my GPR year, I actually applied and interviewed for perio, and it was like the week or like a week before the match, like that list was like due.
Yeah.
I had a conversation with my program director at the GPR, and I was like, I'm having really cold feet about this. I don't know if it's something I can really commit to. So I decided at that cycle that I'm probably just gonna table it for now. So I didn't rank anything. And honestly, looking back at it, I think it was a good decision on my part. I kind of feel like I don't know. There's not a single specialty where I feel like I'm 100% kind of in tune with, like, yeah, I love this. I'm crazy about this. So I kind of feel like that's why general kind of fits for me more, at least at this moment. I would be open to kind of, learning some more stuff, seeing if anything down the line interests me. But that's kind of where I'm at right now. I went through a big peds phase as well. That was also short lived, like you said, until I had my first screamer. Yeah, so that's kind of the two that I was kind of teetering between. But
Get the
yeah,
papoose. Get the papoose. Yeah, the scream. Oh man, yeah. Thank God I can do IV sedation now.
yeah.
That helps for a little bit. But screamers and then managing patient and parent can be tough at times, especially if it's totally disjointed and not coordinated at all.
Mhm.
Or one wants one thing and one needs the other. But man, when did you? So you were thinking perio?
I was.
Interesting.
The rationale behind that was, well, two things. For the first part, I kind of feel like going into the VA, I already knew it was going to be a very surgery heavy program. And at the time, my roommate back in dental school, we were talking about it. He's in ortho residency now, but we were chatting. It's like, I was kind of on the fence. Like, do I want to do more training after GPR year and stuff? Because I don't know what I'm going to do after that. He's saying, if you think about it, you're kind of already in a surgical path. Like, just go for it, like. And then even at my school, so my school's known for, it's a 3-year program. So it's known for kind of being more on the clinical side. But I want to say my year, we kind of had a shift where a lot of the class was getting into residency and specialties and stuff. And even with the mentor, and even with our faculty, some of the specialists at school were saying, if you can get the opportunity to specialize, like, just take it. So I really took both of their advice kind of into my head. And then I started researching Perry a little. We had a rotation at the VA too. And I was like, like, this could actually be a pretty good route for me. It seems pretty interesting. But as I kind of went along with the interviews, I felt like I was just, I don't know, why perio kept popping up. And I almost felt like I was saying an answer that they wanted to hear, as
Mm,
opposed to like something that I actually meant, if that makes sense. Like, it
yeah,
almost
yeah.
meant I'm just saying what I can to get into this program right now. And I had to kind of reflect on that. Like, hey, why do I actually want to do this? Is it because of all this advice I've been giving by my mentors and like my friends and stuff? Or is it because it's actually something that interests me? So just kind of, having that in the back of my head, I'm like, if I'm already having this doubt now, I don't want to be, a few 100,000 more in debt halfway through residency, realizing like, what did I just do? So
Yeah.
that's something that was kind of eye opening to me. And as of right now, I'm kind of happy with where I am, but I would be open to kind of seeing what else there is. And right now, it's just the beginning. So we'll see.
And that's a great point. And another thing, another perspective is like, what would you need a perio residency for right now?
Yeah, that's true.
Is there anything else you need to do that you actually need to do with your career to be fulfilled or satisfied or just be interested in or passionate about? And is it that much more than you're doing already?
That's true. That's honestly, it's hard to say because I can't, like I was saying earlier, there's not a single. I like how in general I can kind of pick and choose things too. But when you're the specialist, you can't. I guess you can't really kind of pick and choose. You can refer to other specialists, but I don't know if there's anything in a specialist line of work that would kind of be more fulfilling, I guess, for me, or like a little bit that I'm like, yeah, now I'm happy with where I'm at and stuff. So it's kind of interesting. I don't know. It's something I haven't really considered, and that's why too when dental students ask, they're like, "Hey, I'm approaching the end of dental school. I'm in between these two specialties. What do you think?" I frankly tell them no. I'm like, I feel like it's pretty normal to not have things figured out because even now, I'm out of school and I still don't know what exactly it is I want to do. I don't know how you're expected to kind of figure that out of 4 years of school and stuff. So yeah, I don't know.
Yeah, it's a great point. I mean, we need to have enough experience in doing it to really, enough exposure to one thing or another or a certain procedure or, Tennessee for that matter. You need to be exposed to it long enough to be like, I really like it or I don't really like it here and I got to move
Yeah,
somewhere else. Like,
yeah.
it's exactly what you said. When you're in dental school, you're not exposed to something and you're not doing things as much as you really need to make that decision. And that's where a residency comes in, right? I mean, I guess that's the answer to do at least maybe a GPR residency, get a little more exposure to certain things. And then, and that's why you had a multi-specialty VA clinic.
Yeah,
Yeah,
we had everything, but obviously not peds. But we didn't do
true.
ortho
Yeah.
either. But we saw peds in the hospital a lot. Lots of that was our main call, I'd say. Mostly peds, just like trauma stuff, but nothing too crazy. Yeah.
Yeah, yeah, I like that about the VA. That was our only clinic, really. That was all one floor, one clinic, but
Hmm.
multi departments: endo, perio,
Hmm.
GPR, pros.
Hmm.
OMFS, and then I think there might have been one other one. I don't know, but you get it. You get it. That
Yeah.
was nice having everyone all on the same page, everyone communicating with each other. It's like in the dental school, that doesn't always happen.
Yeah. I feel like, oh my God, I remember running like a chicken my head off, like running the second floor, trying to get in line for an endo consult, me and like 30 other people. And then you have like 3 hours to do something. The patient's just sitting in the chair. You run back saying, I'll be right back. And then that's just kind of how it is. But yeah, that's what I liked with the VA. And I feel like that's kind of where I'm seeing a lot of people are saying dentistry is kind of headed, kind of group practices now, a bunch of specialists under one roof. And honestly, like that made, I think that's what made the VA kind of fun. It was
Mm.
like, let me just hop over real quick and I'll get another opinion on this. Or, hey, can I show you this? What do you think? Whereas, when you are the solo doc, it's very different. You can't have that. You don't have that flexibility there. So yeah.
When it's multidisciplinary environments, it can be a lot of fun.
Yeah.
I miss that a lot. I think it's almost like a team or like a sport feel where it's like you're gonna go do this position now, or you're gonna go to this specialist and do that. But
Are you the only surgeon at your practice, or is there someone else there with you?
it's a multi. He's got like 8 or 9 offices and like 8 or 9
Oh,
surgeons working for him, and there are 2 surgeons that work with me in my office. Different day. I'm there Monday through Friday, but then 2 days there's one guy there, and then there's 3 days where another guy works there. So it's 2 surgeons in it, and it's good, but it's just a surgery practice, and I think it would be cool to have like multiple specialties and stuff. But that gets to because then they all keep the patients within that conglomerate of
yeah,
these,
yeah.
these DSOs that we're seeing. And then another thing is, um, I don't know. It's so easy to corporatize that. I don't know. It's going so corporate. Are you at a DSO or a private practice?
Private right now, but I actually went through a DSO. I almost like went for that route. Big DSO. I don't want to name drop them, but they wine and dine. They flew me out to their headquarters, type of thing. And I don't want to say fell for it because honestly, like a lot of my classmates are in DSOs, and some
Same.
of them actually they love it. They love how fast paced it is, how all the hands on technology and stuff. But others are like, this isn't what I signed up for. I feel very kind of tricked by all this.
Yeah.
But I almost went down that route, but I don't know. I don't know. I just heard a lot of kind of mixed things about it too, and kind of I know it's very kind of owner dependent because my friend that loves
Mm.
it, he mainly loves it because of his owner doc, not really because of the company itself, if that makes sense.
Absolutely. That's their protection. That's your shelter
Mhm.
and protection from whatever might be coming. Like I know a guy I just chatted with him the other day, 2 weeks ago, and he was saying that, you might just get a phone call and they ask like, why didn't this end up being 3 crowns? Like did this end up just being 2 fillings and that was it? And it's like they're pressuring you to upsell and upcharge. Dude, that's not
Mhm.
dentistry, man.
Yeah.
And then on the contrary, it's like, yeah, I hear you, man. I got friends that are like, it's great. I go in, I work 9 to 5, and I go home and I don't worry about a thing.
Mhm.
Kind of nice, but they're taking a big chunk of your paycheck, and especially in places like New York where the taxes are high, like you kind of need that paycheck now. So,
Mhm. Yeah.
I don't know. I don't know. I'm glad you're in a private practice group though. Hopefully you get some responsibilities where you can kind of work your way up, and hopefully there's like an owner track at some point. That's what I'm looking for.
Yeah.
I'm not shy about it. Like we got to let them know we want some skin in the game, man. You want us to go take dentists out, and you want us to do this and that and
Mhm.
market and go. We're all for it. We need some skin in the game, man.
Yeah. No, I hear you.
Yeah, I it's something I noticed with the older docs is they're living in an era or from an era where there were so many opportunities for partnerships, for buy-in, for practices, places to work,
Mhm.
and now it's like you kind of know if you want DSO or not, or. And again, some DSOs are great. It depends on are they very numbers driven or are they more
Mhm.
like experience driven? That's another thing. But yeah, yeah. Anyway, yeah, you had some great videos lately that touched on a bunch of topics I wanted to hit on, but we had to reschedule and
Yeah,
stuff. And
yeah, no, that's fine.
but what time is it there? Are you Eastern time?
I'm Eastern. Yeah.
So you're almost 10 o'clock too.
Yeah. Yeah.
All right, just a few more. I won't keep you long.
Yeah.
In
No, you're good.
California, this is another thing. In New York, you're required to do a GPR at least 1 year residency before you
Mhm.
work. Is it the same in California? Or can you just go and work?
You can just go and work. But two of my buddies, so it was funny that it worked out because the match system, it's super random. But there were 6 residents at my GPR, and it was 2 from my school, 2 from UCSF, the other school in San Francisco, and
Mm.
then 2 from NYU. So it's funny because we all had a buddy there that we kind of knew, you know? So I got to learn a lot from the NYU people. And they're saying, yeah, like at least one of them, she was only there because they needed the residency for New York. She knew she wanted to go back eventually. But it's kind of hearing how each school is so different was really interesting to me. I know from what they were saying, it seemed like NYU like worked them like a dog through lunchtime, like they were booked. That meanwhile in California that never really happened. So you kind of see the difference too in terms of like how they're able to manage their patients and stuff. Because like my colleague that I was sitting next to, she was like booked and busy all the time, like turning over patients like it was nothing. And meanwhile, me over here, I was still like trying to manage my time and everything because I only saw like 2 or 3 patients a day, whereas they would work through lunch like repeatedly apparently. So it's kind of
Well,
crazy.
wait a minute. Let's see. So I did go to Stony Brook where we had like the block from like 10 to 1 and then 2 to
Uh-huh.
5. So you'd see
Uh-huh.
one, maybe two patients in the morning at
Oh
Stony Brook
yeah.
Dental School. At NYU, here's
Uh-huh.
another thing though. You got to understand there's some days where some of those students wouldn't even come in. Like if they didn't have a patient, they could stay home. I was never allowed to stay
Really?
home at Stony Brook. Right. So they could work if you could get patients at NYU, then you could work through lunch, you could get things going. In
See.
some cases, it was like, and they had night clinic. They added on a night clinic like a few years ago. It's a lot, but you're not required to be there or do whatever. You know what I mean? There's a lot of variability. Like, can you get patients? And if you can you find ways to book them with certain, if they got
Hmm.
to go to OS, they got to go to whatever it may be. That's what I saw in my friends that went to the dental school side of NYU. So it was also very person dependent, you know?
Got it. Got it. Yeah. Interesting. My school had a night clinic, and like you were saying, it was I think towards the end of my year, they started to crack down a little bit more because they're realizing, hey, these people are checked out. You know, like they don't really want to come. They finish their grad requirements. They don't want to come in anymore. So they started implementing this almost on call thing, I guess. They were like, okay, for today, these 2 students, you have no patients, you're on call, and they expected you to just be in the building. Like you didn't have to be in clinic, but just be in the building. So if an emergency patient came in, you would take over. And I remember one day, so San Francisco, it's a really 7x7 peninsula. That's why they're the 49ers. And it's just, I was on the opposite side of the city. Then I get a call from a random phone number I don't have saved. And then it's my program, no, my office coordinator, or I forget her title. She's like, "Hey, we have a we have a patient. Can you come in right now?" I'm like, "Oh shoot!" I was on the opposite side of the city. It was taking an hour to get across. I forget what I think. I was like, "Oh yeah, I'm just at the grocery store right now. I'm getting lunch or something. I can be there." So I book an Uber. I get there, and the time I get there, they're like, "Oh, don't worry about it. Someone else already took it." I was like, and then I was like, "There goes my day off," type of thing. But yeah,
That's
funny
rough.
times, funny times.
And you said that it's very clinical over at UOP?
Yeah, because it is 3 years, I think they teach you really what you need to know to pass boards and to graduate. But so things like OS, for example, unheard of for my our school. But my year, we had 3 or 4 people match, which is like really odd for I guess our school because that doesn't really happen. But a lot of people went into like ortho, OS. We had like a few. What else was there? A few perio as well. But I think we are a bit more on the clinical side. But I don't know. I am starting to see some of these other schools as well that are pretty clinical too, and their numbers are definitely a lot higher than what we had to do. So it's kind of crazy seeing how each school too is so variable in their requirements.
Very variable. And there was a big drop after COVID. I
Yeah,
think
yeah.
a lot of them dropped their requirements after COVID. It's almost too bad though, because I feel like schools are going more academic and then they're
Hmm.
just like didactic and then they're just pushing the clinical work to residencies. And it's
Hmm.
like, I don't know, they're not doing residencies any justice because they're not setting students up for when they graduate to be able to handle the workload. I don't know. It's really interesting in what's going on. And then I mean down south you have High Point that's basically
Yeah,
owned by a DSO and they
yeah.
just opened up that school. So there's a lot of weird changes in dentistry that have been going on.
That's
So,
really interesting.
but yeah, man. Hey, we could always do a part two. We could do a
Yeah,
part two.
for
Let's
sure.
plan some of these topics.
Let's do that.
Let's yeah, maybe we put on like the story or something, and let's have people like submit like when we have the we'll like kind
Yeah,
of introduce. We're gonna have a part two. What topics you want us to hit on, and we hit on them. You know what I mean? We can throw it up on the story, get some suggestions, and we could punch on those topics.
yeah. I'm down. How do you stay so like I guess on top of it, or so like? Do you not run out of? I guess because with me, I'm running out of ideas almost. I'm like I don't know what else there is. But how are you staying so I guess like fresh and just like new ideas all the time?
With content creation, with
Yeah, I guess so.
podcasting, with content creation, I just talk about whatever is on my mind. Whatever comes to mind, I'm like, huh, I'm really pissed off about this today.
Hmm.
Or like, why am I studying for the boards right now? Because I finished residency. Like, it's time to kind of like relax a little bit, just focus on the career. I'd like to start a family, get married. Like, let's move
Yeah.
on. But now this next 3 months, I'm really buckling down. And I'll just say it. Like, I don't even know why I'm doing this. So you don't get better reimbursement
Hmm.
from insurance companies for any treatment.
Hmm.
The malpractice insurance doesn't get cheaper. So it's really just kind of like a marketing tool, to say that you're a board certified. They like quote unquote, they levels the playing field where you're a
Yeah.
board certified. But it's also very expensive. It's a lot of time and sacrifice where it's like, at this point in my life, I'd really rather, I like this is, I would be studying right now probably, but here we are, we're chatting. I really appreciate us chatting and finally get to meet. You're in Tennessee, I'm in New York. And I don't know, I appreciate this a lot more than if I mean, I'm not talking down being a board certified oral surgeon, but that's just something you get to write on paper. And it's like, I actually get to meet you now. I don't know, like that time is, I think, better spent with meeting other people. But, so I just talk about, I'm like, look, you don't have to be a board certified to do
Hmm.
oral surgery, but I don't know. And dude, you've been doing it too, man. And you've been having that combination where it's like humor, but it's also like serious about stuff that goes on in the office. And, relatable so that it's engaging to the viewer. It's just that combination.
Hmm.
Is that kind of your thought process with it too? Where do you kind of, you're saying you run out of ideas? I know what you mean because we're so
Yeah.
engulfed in work, but yeah, tell me what are your thoughts?
I think so. I'm trying to put out some variety too, because I kind of feel like I don't want to. I don't know. I try to do at least like an educational type of thing, a kind of like think discussion post type of thing, like you're saying,
Hmm.
whatever's on my head, and kind of like a funny one too. And I think it kind of gives me some variety as well, so I'm not just like burnt out with one specific niche type of thing.
Mm.
But I'm actually curious one more thing too.
Yeah,
What
yeah.
you think on this? So I've noticed that with different social media platforms, you have to, I don't know, the audience is very different. I want to say Instagram is a lot more, not nice, but a lot more refined, I guess. Like you never really have to deal with any of those like trolls and stuff. And then you get to TikTok. I think I talked about this to you like the other day. Like you'll post something and people will get so offended. Like I think back in dental school, I posted a video that was like it was like a hot take thing, but I was like, I get disgusted when something like a prophy cup picks up saliva. And then it started taking off. It's like, oh, this is great. It's getting traction. But then the negatives started coming in. It was like, you're the reason why I don't go to the dentist. Like, you're judging me. And I'm like, dude, I made a video on saliva being gross. Like, what are you talking about? And then it almost turned into like a cancel. I was like, okay, I'm not dealing with this. It's not worth it. So I took it down. So I feel like TikTok, you have those people, and you also have like I think we were talking about with the dentists that like the no name, like they hide behind the random thing. And they're like, this is stupid. Like I could have done this in like 2 seconds. I'm like, then post it. Like, what are you saying? It's just weird. I don't know. And then Facebook, oh, Facebook's even worse. But yeah, I don't know. That's kind of why social media can be so frustrating sometimes too. Because I have these ideas, but you have to kind of think nowadays. It's like, how will this be perceived in the most extreme way? Even though it's not that way. Hopefully, you get the audience thinks that way too. But
Right,
sometimes,
right. Like you literally have to spell it out. I got crushed on a post. I had to delete it. This is like 2, 3 weeks ago. It started blowing up in the bad algorithm, where all of a
yeah,
sudden people are took you an hour and 15 minutes to take out a tooth.
that's ridiculous.
And like from my perspective, like yeah, it did. The patient wouldn't get a CBCT as much as I wanted to, but finances issue, whatever. So it took me an hour and 15 minutes. I'm drilling around the nerve. I'm trying to avoid the neighboring roots, and I don't
Yeah,
want to hit the tongue on the inside. So it's like I have to be. I'm drilling a little bit at a time.
yeah,
Anyway, so that's from my perspective. I was explaining how I was like it took a long time, hour and 15 minutes, and digging around in there. Blood was on my arm, and then the last thing I mentioned was like, mind you, this is all for like Medicaid reimburse this
yeah,
for
yeah,
$65. And then it went into this bad algorithm of like, I was getting triple time where one was like, oh, you must be new dentist, huh?
yeah,
Took an hour and 15 minutes. No, that's
yeah,
this was on the bottom of the jaw, dude. Like could have fractured the jaw. And then the other one was like, you walk around with blood on your arm? What do you think? You're cool? This is exactly what. That was the comment. This is exactly why I don't go to the dentist. And I'm like, dude, if you look in the background, I'm literally in the bathroom walking up to
yeah.
the sink. Like I'm watching. I just finished, and I'm like, and then the other one was like, wow. You treated this patient differently because of Medicaid fees? How did you make this assumption? I'm
It's
literally
so
this
frustrating.
guy passed by 7 doctors and surgeons that all passed him on, and now it came to me. it's a carious tooth in the bottom of the jaw. It needs to go.
Yeah.
And now I'm the one that do it. But now it's, yeah. So, dude, I totally understand. And that was all on TikTok. It was all on TikTok. Facebook got pretty bad after a week. I had to delete this. No, it was like 3 days. I had to delete it after 3, 4 days. But, and then Facebook, I never even posted it there. Dude, I do this thing. This might help. I post on twice a day, once in the morning, once in the evening. I'll do a clip from a podcast or a TikTok live or something, just like Q&As, right? Answering questions in the morning. And then the afternoon, I'll do like I'm just walking and talking whatever's on my mind. And this way I get a lot of reps in and I evaluate the videos that do better, get better engagement, likes, views and stuff. Those are the only ones I take to Instagram and post there. So I'll do TikTok, TikTok to YouTube Shorts to Facebook, and then I'll do usually they have like some message in them, so I do post it on the podcast, even if it's like 15 seconds. And then only the best ones, and I'm usually looking at TikTok generally, and the best ones there. That's what I bring to Instagram.
Yeah.
But it's like a
it's a whole thing. Yeah, I think I don't know. It's cancel all this stuff is really interesting nowadays too. But
it's tough, dude. It's tough. And then so here's another thing. Something I noticed of those, the people talking about like, wow, it only takes me this time. It's always like Dr.
Yeah.
Dot, no bio, no picture or anything. It's always like a Dr. Catman or something.
Yeah,
It's like a weird, and then another one with typical accounts was, it's like a cat account. There were three on that post. There were three talking about like it was in the Medicaid algorithm loophole, rabbit hole, and there were cat accounts where it's like Mr. Fuzzy Wuzzy, whatever, and it's a picture of a cat. All the videos are cats, and they're talking to me about how like I'm such a bad dentist for Medicaid and this and that, and it's like I'm the only one taking Medicaid around here. So
yeah, I'll make sure to keep an eye out for that too.
watch out. What else can we talk about as far as content creation and that stuff?
I mean, that's what I've noticed too. I don't know. It's a really weird type of. I almost don't like how it's kind of like it's like a game almost. Like I don't know. I want to be very transparent about things I'm saying on there, but now that this whole like we're talking about just now, it's like it's very like you can't say exactly what you're thinking and what you want because it will. I don't know. It'll because honestly, social media. I think we're looking at it from two different lenses. I think the general public kind of views it as like a more of like a hobby, like a random thing you're posting. But on our side, it's more honestly, it's becoming like a business tool. And I feel a lot of practices, a lot of dentists now are starting to use it for that too to get their name out there. So I feel like they're not really approaching it with that type of lens, I guess. So they're bashing it and stuff too. So it's really interesting. Like you have to walk a fine line. And then also if you're a dentist posting this stuff, like, oh, that's not really professional. So it's like you can't really win. I don't know. It's interesting. Like I posted a video the other day about like I ran into my patient at Costco. And I was like, oh, I said hi to them. And just some of the comments were like, that's a HIPAA violation. I'm like, that's not a like just like going off on that, and I had to delete a bunch of stuff. I was like, I know it's not, but I don't want to plant this seed in someone else's head that gets the completely wrong idea. And then all of a sudden I'm the bad guy for saying hi to my patient in a grocery store. I don't know. It's
There's nothing wrong with that. There is nothing wrong with seeing your patient in the grocery store and saying hello to
I
them.
know.
It's like, from an outside perspective, it's like, oh, maybe they're friends from high school or growing up, or like they met at a baseball game. Who knows, right?
Might as well go on the loudspeaker and say, "Oh, hi, this is my patient. He's in aisle like 30 right now, like getting milk. Guys, come and look." It's crazy.
This guy's got lots of cavities
Yeah,
just on the
honestly.
loudspeaker at Costco. That is so true, man. Dude, that's one of the posts that I liked that you were saying. This was such an important one where how do you look at another provider for being on making social media content or not? Right. And so you just mentioned from a patient perspective, it's like, well, should they be doing their work and not be making like social media content? And I completely disagree with that thought mindset. And I think you and I are more, it's like we're putting ourselves out there and we're putting ourselves out there to kind of show patients like, you might vibe with us and you might not, but we want you to have the best experience at the dentist office. There's a lot of anxiety, a lot of nervousness.
Yeah.
By us putting ourselves out there, and sure, you could call it like a business tool. I would really call it like it's a marketing and network tool for you to connect with the dentists that are like-minded and connect with patients that are going to connect with you well, that are going to feel comfortable in your office and under the work of your hand. You know what I mean? And I think social media is so important. We're putting ourselves out there. We're getting crushed. We got targets on our back, but like this is, I think, how we bring healthcare to a greater space. I really do.
Yeah, I agree. I'm seeing a new one right now too. She's a oral maxillofacial prosthetic, pros resident right now. I'm seeing a lot of her stuff pop up, but it's really interesting because I've heard of it, but I never really see it, I guess. Like I remember during GPR, I was on a hospital rotation. This patient, we only worked really with ENT and plastics because there's no OS. There's no OS program at Stanford,
Ah,
and she had to get a total glossectomy. And then I remember I was crushed. I was like, it's crazy because she was like my age, and then I had to round on her after, and she couldn't talk. And I was like, how is she going to recover from this? It's kind of crazy. And then I just totally failed to even consider there's another side of pros that kind of, specializes in these type of things. They deal with this. So it's really nice too, not even just learning from other people, but just seeing what else is out there too. Because there's so many tricks, even on Instagram, that I've learned. And then my dental assistant's like, what are you doing? I'm like, oh, watch this. Like, I saw this online. And then it works out really well. Sometimes it doesn't, but for the most part, it works out pretty well. But it's pretty cool. Yeah.
oh, that's such a great point. Yeah, the prosthodontics, the maxillofacial portion of it, when they really get into soft tissue, hard tissue combinations, for phonation, for function, mastication, chewing food. Yeah, it's a beautiful thing. That's a really cool part of the. There was another one, like a what did she call herself? Like a maxillofacial orthodontist? I don't know. It was something crazy. I was like, whoa, I don't even know how that kind of works, but I'd like to learn. Yeah, man, dude, we'll have to have a part two. We
Let's do that.
there's yeah, let's plan these topics a little more. I wanted to bring a couple more, but we did get to that video where you're saying, providers that make content or not. And that's another thing. I mean, just to round out that topic one more time. Patients look for people with content. Sometimes, right? They look for reviews. That's number one. But then on the provider's website and social media pages, it gives you an idea. It's like a pre-consult. You kind of meet what that provider's like and how what their vibe is before you even meet them. I think it's only benefits. The problem is that we have some algorithms and cultures on social media that just want to cancel everyone.
Yeah. Yeah. Oh, I've never actually thought about it like that, like a pre-screening, I guess, because I don't want, you go to a dentist, you see 5-star reviews on Yelp or something, and you sit in your chair and you realize, like, hey, like a big part of dentistry, aside from the clinical skills, is kind of just like your rapport, Like I don't
Yeah.
want my patient to be in the chair and kind of uncomfortable, I guess. So definitely looking at social media beforehand is like, hey, a pre-screening, if you will. Definitely a valuable tool that I never really
Huge,
kind of,
right? Yeah, man. Yeah, patients got to utilize it. We have to utilize it. All
yeah,
right. So, all right, dude. Hey, thanks for coming on.
yeah, man.
And
Thanks for having me.
we'll have a part two. If you can do me a favor, just wait like 10 seconds. It'll show like a line that it's uploading. Once it's like 100%, it'll take 5 to 10 seconds. And
Yeah, for sure.
then, all right, dude. All right, let's finish up this week strong.
Okay, yeah, me too.
I'll talk to you later.
Yeah, talk to you later.